manage in urology are listed over here. The most prominent condition is supposed to be the urethral stricture disease. Obviously, we are going to discuss certain cases as well of different conditions in this presentation. Now, urethral stricture. Urethral stricture is basically, it is abnormal narrowing of urethra, as you can see in these pictures. The urethra is narrow, which may obstruct the flow. Sometimes it causes retention as well. As far as the etiological factors are concerned, there is a long list of etiological factors. But the worst part regarding this is, it is believed in urology that almost 50% cases of urethral stricture are iatrogenic, means resulted from instrumentation and surgeries on lower urinary passage. So, in other words, hospitals generate almost 50% cases of urethral stricture. This is very unfortunate, but at the same time, very true. Now, to understand the exact nature of the disease, first of all, we need to understand the nature of urethra. So basically, urethra is a collapsible pipe which remains closed for 24 hours. It opens only when a person passes urine. As soon as the urine is passed, it closes or collapses again. So being a collapsible pipe, it has got its two distinct qualities, elasticity and caliber. And these two qualities are very important for the normal function of urethra. Now, the pathology is a quite complex process, but basically, it starts with a wound or ulceration inside urethra. So whenever there is wound on any part of our body, eventually that wound heals and it leaves a scar. The scar left is definitely much smaller as compared to the actual size of the wound. So any wound contracts significantly, and this contraction is up to almost 80%. So if there is a wound inside urethra, even that wound is going to get contracted, and this is how the whole pipe of urethra gets constricted. This is the first part of pathology. Now the second one. Whenever a wound heals, it heals by granulation. And when the granulation approaches the epithelial lining, the process of granulation stops over there completely. Now, in case of urethral wounds, urethra carries that salty acidic urine many times a day, which interferes the process of granulation. Again, wound healing is a natural process. So when nature realizes that this particular wound is unable to heal, nature tries her best to heal that wound at any cost. And in that attempt, the rate of granulation increases significantly, and that's why there is hypergranulation inside the lumen of urethra, which later turns into fibrosis, which is called as the actual scar tissue of the stricture. This is how a stricture is formed. Now, that particular tissue, the previous one, yes, that scar tissue is called as the spongiofibrosis structural scar tissue of the stricture. The diagnosis is confirmed Okay, there is a long list of symptoms. They are shortly called as LUTS, lower urinary tract symptoms. But the main thing is, for a person suffering with urethral stricture, there is no personal life, no sexual life, no family life, no social life, no professional life. So in short, that person's life is totally destroyed by this disease. I have seen many patients who literally committed suicide because of this disease. It is that bad. Regarding the diagnosis, it is confirmed with special investigations like retrograde or ascending ureterogram and the micturating cystourethrogram. The diagnosis is confirmed. As you can see, the narrowing, which is clearly seen in these investigations. The next is uroflowmetry, which is supposed to be absolutely a non-invasive investigation. In this, that patient has to pee into a tub which is attached to a PC system, and that gives this graph. In this graph, certain things are important. The max flow rate should be at least 15 ml per second. In this case, it is quite compromised, 4.9 ml per second. Average flow must be around 10 ml at least. And the residue, post-white residue urine should be minimal or nil. Now here it is quite compromised, as you can see. As far as the treatment is concerned, there is no effective conservative or promising conservative treatment for this disease. It is only palliative or symptomatic. As far as the next step is concerned, it could be in the form of urinary diversion, either in the form of suprapubic catheterization or in the form of perineal urethrostomy. But it is definitely temporary. So the next option remains is of only surgical management. The first option is urethral dilatation. Under anesthesia, different dilators are introduced to open up the stricture. But when they introduce a dilator, especially the large size dilator, it won't go in easily. So the urologist has to force it in. Once they force it in, a new wound is formed. Once a new wound is formed, the pathology restarts, and that's why the stricture recurs within 1 year of the dilatation. That's why the dilatation is posted near the birth date of that patient to remind him or her that it's my birthday and I have to go for the dilatation. That's why it is also called as birthday dilatations. The next option, DVIU, direct visual internal urethrotomy. In this, they introduce a urethroskop. The stricture is located and it is cut to release it. Using whether a urethrotom, cold knife or a laser, whatever they use, they have to cut it. Once they cut it, a new wound is formed and the pathology unfortunately restarts, and that's why even after the surgery, the stricture recurs within 1 year of the surgery. That's why most of the urologists, after the surgery, they advise that patient to go for the clean intermittent self-catheterization, CIC. That patient is taught to perform this on her or his own. Now the ideal frequency advice is initially that patient has to do it every single day, then the frequency has to be reduced from single day to alternate day to twice a week to weekly to fortnightly to monthly. But once the patient starts reducing the frequency, it gets harder to introduce the catheter. And though the patient follows it sincerely, still that patient has to face the next surgery within 1 year, so the pathology restarts and the disease recurs within 1 year of this surgery. After going through multiple surgeries, actually this CIC has got associated complications which are very significant, like recurrent UTI, injury, rupture urethra, new scar formation, multiple strictures even, and this is the ascending urethrogram of one of our patients, in which you can clearly see a very huge false passage created because of the regular CIC. After going through multiple DVIUs, that patient is advised to go for, which is supposed to be the last resort for the management of stricture. It is an open surgery. In this, they open up the urethra, the constricted part is excised, and that part is reconstructed using the buccal mucosa, called as buccal mucosal graft reconstructive urethroplasty. Again, there is in fact a bigger wound going to form during this surgery, and that's why even after the surgery, the pathology recurs. Dr. Sanjay Kulkarni from Pune is supposed to be the authority for urethroplasty. The procedure is in his name, Kulkarni's procedure. And we have treated many patients who have already been operated by Dr. Kulkarni with his procedure. So, to conclude, the basic thing is, it is very clear that the results of conventional urological treatments are not really very promising, and the treatment of stricture remains a challenge despite of those much advancement in so-called conventional or modern urology. And it is officially written in the textbook of urology that once a stricture, always a stricture. So this is all about the urethral stricture disease. Now we'll come to the treatment of this disease in Ayurveda. What exactly we do for this disease in Ayurveda? Uttarvasti, calibration of urethra, oral medications, that too only Ayurvedic. Next, please. The procedure of Uttarvasti. Please play the video. Now, the way we perform this particular procedure at our institute, the procedure of Uttarvasti, obviously the procedure has to be conducted under very rigid aseptic precautions. That's the most important point. Even the medicine should be properly sterilized. For Uttarvasti, one should never ever introduce a catheter into urethra, because catheterization or instrumentation inside urethra is one of the important causes for stricture formation. So just for the sake of Uttarvasti, one should never ever do that. The medicine is introduced with that small adapter. The procedure is absolutely painless. We have managed patients of age ranging from 5 years to 96 years within last 22 years. And with this, I can confidently say that the procedure is definitely painless. Yes, though it seems to be a very simple procedure apparently, but we have observed and managed hundreds of vasovagal events while performing Uttar because Basti is out of 3 marma. Shiro, Ruday, Basti. So whenever you are working on urethra or bladder, with that due respect to the nature of that marma, the procedure has to be very gently when we push the medicine. Now, for most of the patients who are apprehensive or with comorbidities, we always keep an intensivist standby while performing Uttar Basti. Generally, we introduce 60 ml of the medicine. In case of female also, we do the same way. No need to introduce a catheter. We just introduce the medicine through that adapter called as Foley's adapter. Now, this is the calibration. It's not only that we need to do Uttar Basti. At the same time, to restore the caliber of urethra, we need to do the calibration. Now, initial 5 day, we do only Uttar Basti with Lekhana Dravya Siddha Tel, which makes that fibrosis, spongiofibrosis soft. From 6th day onwards, we start the calibration of urethra. Even this is performed under local anesthesia only. We introduce that lignocaine gel, and then we introduce different size catheters. On 6th day, we introduce 10 and 12 French catheters, which are very thin. And that too, we have to introduce those catheters very gently. Now, for this patient, this is the last calibration. We do calibration starting from 10 French to 20 French. This is the 20 French catheter. There is standard color code. The yellow color shows it is 20 French. For 18, it is red. For 16, it is orange. For 14, it is green. For 12, it is white. And for 10, it is black. So this is the last calibration. And the calibrations are also painless. We perform this calibration, these calibrations for even that 5-year-old kid as well. So it's not only while introducing the catheter, but even while removing the catheter, it has to be with that gentle care or due care with the nature of urethra, because urethra is supposed to be the most egoistic part of human body. And you can see there, while removing the catheter, there is not even little blood stain on the catheter. So that's the best part of this procedure, that we are opening up that stricture without causing a new injury. So actually, when we are able to introduce an 18 French catheter with ease, without resistance, that means we have achieved the normal caliber of urethra. For an adult, that is the normal caliber, 18 French. We go just one extra size. Now, when the urologists open up a stricture, generally they open it up to at least 22 French, routinely 24, 26, 28, 30, 32 even. Why that big? Because they know that very soon it is going to get constricted again. So basically, to open up a stricture is not a big job. To maintain the caliber afterwards is the main challenge, and this is what we are doing with the help of Ayurvedic treatments since last 22 years. And most of our patients, they are leading absolutely normal life since years after this particular treatment. Now let me present certain cases of this. Thank you. If this is for Ayurveda, it should be with that Josh. Am I expect that, Josh? Thank you. Now, though, as I mentioned that, though it seems to be a very, very simple procedure apparently, but we have seen and managed hundreds of vasovagal events. So whenever you are going to perform Uttar Basti, it should be with that care. It has to be performed in an operation theater. There should be all necessary things to manage vasovagal event, including laryngoscope, endotracheal tube, drugs to handle emergency, and oxygen cylinder. Now, why? In fact, this is the most important slide, according to me, of this presentation. The first point, proper assessment of the patient. This is the most important part. Why? Most of the patients who suffer with urethral stricture, they generally try to avoid the ascending ureterogram. So before you start the treatment for urethral stricture, one must go for ascending ureterogram compulsorily. Let me show you why it is necessary. This is the AUG of one of our patients. That patient was quite reluctant to go for the AUG. But when we force, you can see when that contrast was introduced, radiopaque contrast was introduced into the urethra, the whole contrast was absorbed into the internal iliac vessels. For Uttar Basti, we use an oil-based medicine. If we would have started the treatment of this patient without this, the whole oil-based medicine would have absorbed into the cardiovascular system, resulting into the fatal complication of fat embolism. Even that fat, that oil must have deposited into the lung interstitium to cause acute lung injury, resulting into ARDS. So this is the most important part. So these precautions are really very important. Regarding the results of Uttar Basti, yes, they are assessed clinically and by comparison between pre and post-treatment investigations like ureterography and urethrometry. And the best part which we have observed is the results are irrespective of the site, size, and extent of and even the etiological factor of the stricture. Now let me present one of the most complicated cases of my career till date. This lady was suffering with urethral stricture disease since more than 12 years. And she has to undergo dilatations every 6 months. Otherwise, she used to suffer retention. Suddenly, she suffered retention on 15th of October 12. And when she approached nearest emergency in California, when they tried to introduce a catheter, they couldn't introduce an infant feeding tube. So ultimately, they have to go for the suprapubic catheterization as an emergency treatment. After a series of investigations, ultimately that lady was advised to go for the vaginal flap urethroplasty. When they actually posted the surgery, on 23rd of January 13, I have got all the operative notes of this patient from the operating surgeon, Dr. Christopher Elliott, the neurosurgeon from California. When he tried to introduce a cystoscope, he could cannulate for only 0.5 centimeter. The pediatric cystoscope, 10 French. Then he tried to introduce a guide wire, which is thin like the lead of a lead pin, but he couldn't introduce that guide wire as well. Then they took the suprapubic approach, introducing a flexible ureteroscope, but even through that approach, they couldn't introduce a guide wire. Obviously, they have to abort the procedure, and they explained that lady and her relatives that she has to live rest of her life with this tube only. In short, it is incurable. Next, please. So for most of the patients, once the doctors of USA say that there is no hope, that means there is no hope at all. And we have our website. The domain itself is cureurethral.com. There is an online consultation form. This is how patients get connected with us. It was very hard for that patient to believe. First thing, Indian doctor. Second thing, Ayurvedic doctor. How come? And we have a policy that unless and until each and every doubt of each and every patient is absolutely satisfied, we never start the treatment. And that's why, since last 22 years, we have managed many patients who are so-called modern consultants, physicians, surgeons, gynecologists, pediatricians, and I would say a cherry on the cake. One of our patients, he himself is a urologist. We managed his stricture 8 years ago, and since then he is leading absolutely normal life. So this is the strength of Ayurveda. Next, please. So ultimately, that lady came to us. We started her treatment on 20th of April. Within 10 days, we were able to remove her suprapubic tube with the normal flow. A lady who was unable to pass even a single drop of urine, that lady passed urine with a max flow rate of 16.8 ml, which should be at least 15. Average flow 12.4, which should be at least 10 ml, and it was without straining. So definitely this Ayurveda can do. And not only this, but a lady who has to undergo dilatations every 6 months. She went to USA after the completion of treatment. She came back after 3.5 years in December 17 to see us. Even at that time, her flow was absolutely normal. So we managed her condition in April 13. This is December 25. More than 12 years, that lady is leading absolutely normal life. So with this case, we are challenging that belief, once a stricture, always a stricture. Definitely, it's not true. Ayurveda can reverse this, definitely. Again, if it is for Ayurveda, please, let everybody know. Let the whole world know. Thank you. So we have managed hundreds of such cases with even suprapubic or other cases. Because of the time constraint, I will not be able to present all such cases here, but next time, whenever I'll get the time, definitely, it will be an honor for me. There is a page of testimonials on our website. So many testimonials are given. We have patients from 26 countries till date. Next, please. Now, we'll discuss regarding one more condition called as bladder outlet or bladder neck obstruction. Urethral stricture is a structural obstruction. This is absolutely a functional obstruction. In this, that person is unable to void properly without a structural deformity. Now, let me present this case. A small kid. So, here, the way Ayurveda says, na vegan dharayet na udirayet. Before that, Ayurveda says, Ayurvedopadesheshu videya paramadaraha. Na vegan dharayet na udirayet. So, what disrespecting the urge of urine can lead to, I'm going to present one of the most challenging cases of my career. This kid from Ahmedabad, he must have heard the discussion that if the washrooms are unclean, one should not use such unclean washroom. And with that impression in the mind, he used to go to school by 7 a.m. in the morning. He used to come back from the school by 3 p.m. and used to hold urine for those much hours every single day for almost 4 years. Vegadharan. And the result was this. Next. Look at his bladder, the size of his bladder. Next, please. If you see the size of the bladder, the pre-void, you can see 1081. For an adult, the size of the bladder is 4 to 500 ml. For a 9-year-old kid, it is only 250 ml. It was more than 4 times the normal. And the residue urine was 836 with significant back pressure changes, bilateral hydronephrosis and hydroureter. Obviously, when consulted with, next please, with two urologists, one nephrologist, and one pediatric surgeon. That the family was explained that if you could perform the surgery today, don't wait for tomorrow. Being a single kid of a very rich family, everybody was worried. And then they approached one of the most leading Ayurvedic physicians of Gujarat state, Dr. Tapan Kumar Vaidya sir. And he immediately referred that family to me. Obviously, it was very challenging for me first to convince the family and then the kid. But fortunately, with the blessings of Lord Dharmantri, I could do that. And we started his treatment. Next, please. Uttar Basti, usual calibration, Basti, and double voiding. Then Avgas with oral medications. Next, please. Just after 8 sittings of the treatment, you can see the difference. Previously, when the bladder capacity was 1081, now it reduced to 460 ml. And the residue, which was 836, now it reduced to 123 within 8 days. And the back pressure changes were also significantly improved. The sonologist is the same evidence. Next, please. After 22 sittings of the treatment, you can see the post-void is only 4 ml. And this condition also, this bladder outlet obstruction also do not have a promising treatment in so-called conventional urology. Now, let me tell you, we also manage exactly same kind of one more patient. His father is an interventional cardiologist. We manage his condition, actually, that kid came to us after one surgery, cystoscopic surgery. We managed his condition in August 23, and since then, that kid is also leading normal life. Let me show you the follow-up as well. Next, please. So follow-up after 6 months. Even after 6 months, if you can see, the residue is only 19 cc with absolutely normal uroflow. So I will definitely have this strength. Next, please. So it is very well said that passing urine saves your life. One should never ever disrespect the urge of urine. Passing urine saves your life. Next, please. Now, I would say the most burning issue of this modern era, recurrent UTI, and more than that, multi-drug resistant UTI. Now, let me present one case. This guy came to us, he's 47-year-old, his daughter is a doctor. He was suffering with typical UTI since almost 2 months. He was hospitalized initially and treated with parenteral antibiotics for almost 15 days. There was a significant improvement in his condition. When he came to us, he was consuming oral antibiotics since 1.5 months. On arrival, if you see, there were significant LUTS. Along with that, the body temperature was 104.3 degree Fahrenheit and hypotensive. We do take such challenges as well. So the way we manage this condition, we do bladder wash. We introduce a large bore catheter, maybe 14, maybe 16 or 18 French. Through that, we introduce fresh prepared panchvolcal cloth as much as that patient can take, maximum 500 ml. And then we evacuate the bladder through the same tube with rigorous movement on the hypogastrium. We repeat the procedure. Then Uttar Basti, oral medicines, we stop all the allopathy medicines. And we start only Ayurvedic medicines. Rakta Medo Pachak Quat, total 9 drugs. Sariva, Patol Sariva Musta Patha Katuki, Rakta Pachak, Kiratiktam Amruta Chandanam Vishwabheshajam Medo Pachak. So Quat prepared of these 9 drugs every couple of hours, Muhur Muhu. Then Ushira Sau, 20 ml as a systemic alkalizer, that too in Apan Kal before food, and Saushamanivati. The most important thing to know as of now with this regard is hyperpyrexia is an immune response. So it's not a bad thing. So whenever we use acetaminophen or paracetamol, and if you check the body temperature of that patient after half an hour, you will find that the body temperature goes subnormal. Sometimes it approaches 96 even. So by using that, we are interfering the immune response of the body. And whenever we use a good quality Saushamanivati, Amruta Ghanavati, 2 gram, stat dose, we crush it with honey and provide it to the patient. The hyperpyrexia is very well managed within half an hour, but body temperature never ever goes subnormal. It always lies between 99 and 100. That's why it is called as Rasayan, immune modulator. So that's why we have to have that belief. Now, with all these treatment, the patient gets stable clinically within 24 hours. With biomarkers, if you see, on 15 July on arrival, the total count was 20,180. So patient was in proper septicemia. With only Ayurvedic treatment, within 4 days, on 19 July, the total count is only 6,610. So this definitely Ayurveda can do. Just we have to have that belief, we have to have that faith in our science, in our drugs. So this is definitely possible, and we discharge the patient on the same day. Now regarding the prostate. Basically, the way that patient of prostate enlargement is frightened or scared, the impression given is it is like a very major disease. But basically, it is not a disease at all. It is a result of aging. So after the age of 50, that prostate is going to enlarge, as you can see. Now again, the size is never important. Size doesn't matter regarding the BPH. I have seen one patient whose size of the prostate was 110 gram. The normal is up to 20. 110 gram. And still that patient wasn't having even single LUTS. He was able to void properly. There wasn't nocturia. His bladder was getting completely empty. And I have seen a patient with 25 gram prostate with significant nocturia, significant lower unit tract symptoms. Now why this occurs? Here, if you see the transverse section, this is the urethra. This is the median lobe, anterior lobe, posterior lobe, lateral lobe. These are the lobes of prostate. If there is even little growth in the median lobe, that is going to compress urethra immediately. And that results into significant symptoms. If there is growth in only lateral lobes, no symptoms. So size is never important. So what is important? That we'll discuss later. So next, please. Regarding the symptoms, there is frequency, urgency, nocturia, etc. Next, please. The medicines which are used in conventional urology are alpha blockers. Next. 5-alpha reduced inhibitors, but they have significant side effects as well. Next, please. Now, what we do, oral medication, that to Gokshoti Gugulu, Chandraprabhavati in Apankal again, 2 TDS in Apankal before food. Uttarbasti and calibration of urethra in case of severe symptoms, and Yoga Karma Kalabasti for the regulation of Apan Vayu and restoration of physiology, and yoga and pranayama, especially Surya Namaskar, Parvati Asana, that butterfly posture, and pranayama. Next, please. Now, just let me present one case. This guy, we started his treatment on 11th March. If you see, the size of the prostate was 44 cc. That reduced to 19 cc within 6 months. But again, the prostate size is not important. So what is the goal of the treatment? Next, please. So the goal of the management is the normal voiding function should be restored. That means voiding should be effortless, normal uroflowmetry, insignificant post-void residue urine, minimal or absent nocturia, and PSA should be within normal limit. If we are able to maintain this goal, there's no need to go for any surgical intervention, TURP, because though TURP, transurethral resection of prostate, is supposed to be the gold standard for the management of BPH, but there are significant complications of that procedure. One of them is urethral stricture formation, which we call post-TURP urethral stricture, which is very common. And people suffer a lot after the TURP. That's why we always advise patients not to go for the surgery. Next, please. So there are many such conditions which we regularly manage with Ayurvedic condition. Because of the limitation of the time, I will not be able to present all such cases. Yes, but on our website there is a tab which is we also treat. Under that tab there are many conditions mentioned for which there is no promising treatment in conventional or modern urology, but yes, in Ayurveda we have very promising, quick and non-surgical treatments. Next, please. Now, few things regarding our institute. We have patients from 26 countries till date. Next, please. Once we had a team of Japanese doctors to learn basics of Ayurveda at our institute under the guidance of my Dadaji, Honorable Professor Harishankar Sharma sir. Next, please. I was invited to Japan to deliver a lecture regarding Ayurvedic urology. Next, please. This lady, Dr. Iku Azuma, second one, she visited our institute. Next, please. Many urologists from different countries like Russia, Singapore, Egypt, Algeria, they especially visited our institute to know regarding Ayurvedic urology, and they really appreciated our work in this field. Next, please. Recently, I got the opportunity to deliver a talk on Ayurveda and Ayurvedic urology at the High Commission of India, Nehru Center, London, UK, on 14th of November, recently. And more than this, it's a matter of pride for all Ayurveda scholars that I'm an honorary consultant to Honorable Governor of Gujarat and Maharashtra State, Acharya Devavrat ji. Being the governor of a state, obviously he has got its own medical panel on which there are around 40 topmost consultants of the state. And still, I got the opportunity to travel with him on his private jet. And this status is only because of Ayurveda. So Ayurveda can give you this status definitely. And if it's again, this is because of Ayurveda. So be proud. जरा जोश के साथ हो जाए यारो. How's the जोश? आपको आयुर्वेद निश्चित रूप से इतना तो सम्मान दे ही सकता है. So here's a small introduction of our institute. Volume.
Welcome to Brahma Ayurved, Gujarat's first ever multi-speciality Ayurvedic hospital with world-class standards. Founded by Doctors Jui and Narayan Shahane. We have multiple theatres well equipped for urology, proctology, Ayurveda and Panchakarma. For patients staying over, there are multiple beds, ranging from common to VIP, with special facilities. Guests receive excellent, healthy food and access to an on-duty doctor around the clock. Here you can receive the best of modern healthcare combined with the age-old wisdom of Ayurvedic medicine. We receive many local and international patients for highly specialized procedures such as the Uttarbasti, an effective cure for urethral strictures, performed in our Ayurvedic Urology Center, the first and only in India. Brahma Ayurved. Follow the most authentic and updated science of life.
This is our dedicated team working in the field of Ayurvedic urology since last more than 2 decades. Thank you. Thank you so much for your patient listening, and more than that, thank you, Dr. Girdhar Kaje sir, for giving me this opportunity to present this particular wisdom of Ayurveda in front of you, the Ayurvedic urology. Thank you so much. Thank you, Chairman sir, and thank you other respective speakers of this
Awesome,
stage.
sir. That was very...
The topic is open for discussion. If you have any queries or doubts, you can ask, please. Thank you. Thank you so much.
Thank you, sir. That was very promising and fantastic presentation on the topic given. Very much science-based and evidence-based. Thank you so much for the time. And now...